Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Tuesday, July 14th. Allez les Bleus. And I want to acknowledge that we're on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Wednesday, July 15th, we'll be presenting a written briefing at around 3 o'clock. On Thursday, Dr. Henry and I will be here in person on July 16th. On Friday, there'll be a written briefing. And then there'll be no briefing on the weekend. And then on Monday, we'll be providing some information that Dr. Henry will be presenting, working with the BC CDC about information around serology testing, information around the survey that we did back of 375,000 British Columbians back in May. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. Today we have a total of 13 new cases who have tested positive for COVID-19 in BC, bringing our total in British Columbia to 3,128 people with COVID-19. That includes 1,015 people in the Vancouver Coastal Health Region, 1,649 people who live in the Fraser Health Region, 135 people in the Vancouver Island Health Region, 212 people in the Interior Health Region, 65 in the Northern Health Region, and 52 people who are residents from outside of Canada. We have no new healthcare related outbreaks. We continue to have 3 active outbreaks in the healthcare system, 2 long-term care facilities and 1 in acute care facility. We've had an increase of 3 cases in our healthcare outbreaks, bringing our total to 399 residents who have tested positive and 252 staff. We have no new active community outbreaks today, although yesterday we announced 1 outbreak in the Crazy Cherry Farm in the Interior Health Region of BC. We've also had, as you are no doubt aware, several community exposure events in the interior, particularly in the city of Kelowna. And if you have been at any of the locations where community exposures have been, we are requiring people to monitor carefully for symptoms, limit your contact with others during this incubation period, and contact 811 if you have any symptoms at all. There has been as well direction from Interior Health for people who are in certain places to self-isolate during that incubation period. I do also want to remind people that food is not a source of transmission of COVID-19 for the most part, and in particular we are confident there is no risk from cherries that have been processed at the Crazy Cherry Farm in Interior Health. The processes have been reviewed by Agriculture and the CFIA, and they are safe. And I will remind people that we don't have any evidence of transmission from packaging or from food, but that we should always wash things carefully and wash our hands. So we now have 209 active cases in British Columbia, of whom 14 people are in hospital, 5 of whom are in critical care or ICU. We have no new deaths today, leaving our total at 189 people who've died from COVID-19 and 2,730 people who are now recovered. With every increase in our activity, the potential for COVID-19 transmission increases as well. And we know that. We've known that as we've restarted over the phased approach that we've taken in the last few months. And the number of new cases of COVID-19 in the recent days is evidence of this. And we've had more than we're used to seeing in the last few days. This is not unexpected and is a reflection of a number of things. One is that we are getting out more, we are being more active, and we are, unfortunately, transmitting this disease. But we are also monitoring closely, and public health teams are actively working to manage every single case and make sure we find all of those close contacts who are at risk. We know there will be cases, but we need to ensure we can contact trace quickly, and that's how we all need to do our part to slow the spread and keep the cases to a manageable level so that we can continue to do the things that we are doing. We're now past that first incubation period since Canada Day and since we moved into phase 3. This means having a heightened awareness to symptoms is incredibly important. There may be other people out there right now who are at parties on Canada Day who had been in contact with somebody who had this disease over the last couple of weeks. And you may have mild symptoms. If you have any concerns at all, you can be tested anywhere in BC, and that's important right now. We need to continue to minimize our cases, manage them effectively with public health teams, and modify our activities as we need to do to make sure that we can continue to safely get out and about and open up. We absolutely can get out there and be active, but we need you to do that safely. And we know that we know how to do this here in BC. It is important to remember that if you have an underlying health condition or are older, you are at higher risk of having severe illness. And we also see from other places where they've had a surge in cases that the more people that get sick, the more likely there's going to be people who are going to have more severe illness, who are going to die from this. You may not be aware of the health issues of all of your family and friends. Perhaps they're not even aware that they may have a condition that makes them at high risk. But you can take precautions to protect them and to protect yourselves. Though remembering, wherever you go, we bring our risk with us. So if we've had a lot of people that we've been in contact with, we bring that risk with us if we're going to visit our grandparents or if we're going to visit friends who may have health issues. We know that COVID-19 symptoms can be mild, making it very easy to spread the virus to those that we're close with and those that we're close to. That's why it is so important that we all stay away, stay home, skip those parties, skip that travel if we're not feeling 100% well. That means that you will have the opportunity to go another day. We need to recommit to the basics of fewer faces and bigger spaces. And we need to stay away from those higher risk environments, or if we are in those higher risk environments, make sure that we're doing things that make it safer. And that includes staying away from closed spaces as much as possible. Outdoors is better than indoors. Keeping your group small. This is important whether you are inside or outside. If it's a house party, you may not know all of the people who are there, and you may not know the risks that they're bringing with them as well. There are a number of things that we have in place in restaurants, in bars, in places in our community to keep people safe. And these are not rules to be skirted. These are the things that we need to have in place to protect customers, to protect staff. The requirement in restaurants for no more than 6 people in a group is very important, and it's done deliberately so that we keep those groups small enough that they're not posing a risk to staff or to others in that area. It's a good guideline for our social interactions as well. And just like in a restaurant, that doesn't mean having a big group and splitting and table hopping and mixing. So in a private setting, again, you need to be aware that the more people that you're in contact with, then you are spreading your bubble wider, and that can increase your risk. So from the get-go, we have said stay outside as much as possible. Maintain your safe physical distance from everyone other than your close household bubble. This still applies. And when it's difficult to do that, we need to use those layers of protection that we've come to know. So making sure that we keep our numbers small, to address the risks before you. Think about how you're feeling. Be aware of the risks you are exposing yourself to and the people you are close to. And let's do the right thing. as we have been doing for ourselves, our loved ones, our communities, and the province. And let's, of course, continue to be how we have been, to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. It's, of course, always good news on any day when we don't announce anyone has passed away from COVID-19, which is true today. We're announcing 0 deaths today from COVID-19. We do know that yesterday we provided a written statement. 2 people passed away over the weekend, over the previous 3 days in care in British Columbia at Holy Family, and that was, I know, a significant loss for the community of care at that facility, a significant loss for the friends and family and for the whole community, and we pass on our condolences to those 2 families, those 2 people's families and community of friends, and to the 189 others who passed away from COVID-19 in British Columbia since the beginning of the pandemic. As Dr. Henry has said, we have 14 people still in hospital. That's 9 in Fraser Health and 5 in Vancouver Coastal Health. This number is stable from yesterday and down from Friday. I wanted to note that people are continuing to resume their use of the healthcare system. We had yesterday 6,212 visits to emergency rooms across BC in 2 health authorities, the Interior Health Authority and the Vancouver Island Health Authority. The use of emergency rooms is actually above what it was on March 9th, which we've been using as the standard, and the other 3 is still below that. But what it shows is that our healthcare centers, our hospitals, our acute care hospitals, our healthcare professionals are extraordinarily busy, not just dealing with the pandemic as it is in BC at this time, but also with the many other challenges that people are facing with their health, both physical and mental. I wanted to bring you an update, it being Tuesday, on PPE in British Columbia, as we've done consistently at the beginning of the week for some time, just to bring you up to date from where we are. We were right up to July 6th from the end of March. The following PPE has arrived in BC. Just over 5,940,000 N95 or equivalent respirators. Put that in context, about 331,000 or 5% of those are from the federal government's bulk procurement. Almost 23 million surgical or procedure masks, 2.3 million pieces of eye protection, 53 million pairs of gloves, 2,900,000 gowns. Many of the items I've just listed are in our testing process to make sure the products meet or exceed safety requirements before being used in BC's healthcare system. Today I can tell you that over the past week, and this goes from Monday, July 6th, when we last reported, to Monday, July the 13th, we've received the following: 90,184 N95 or equivalent respirators, 2,022,750 surgical or procedure masks, 2,939,555 pairs of gloves, and 32,350 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product, as well as working with other governments and with the private sector to see the development of PPE manufacturing in Canada. And wanted to say that that work continues not just to prepare us for the coming months, but also to ensure that we have a reservoir of supply that will take us through the next year. So the work continues. Right now we're buying and acquiring more PPE than our current needs, but that is to build up a base for our stockpile and for the future. Wanted to note reports which I understand come out of Ottawa to say that the extension of the closure to visitors of the Canada-U.S. border has been extended another month. We understand this is the case, and this is obviously positive and necessary news. Everybody who lives in British Columbia knows how inconvenient and how difficult that is for many businesses and many individuals for a variety of circumstances living in BC, but they also know the absolute necessity in this time of continuing to take those actions. I wanted to note that we continue to see in neighboring jurisdictions, all our neighboring jurisdictions, increases in cases, whether it's the Canadian province to our east, Alberta, or others, Washington and Oregon and California, in Nevada, in Arizona, and in other American states. We've seen record days of new cases of COVID-19 recently. We obviously are very supportive of the efforts of public health in those jurisdictions to address what is a very challenging situation and are supporting them as well. We clearly need to maintain the current situation at the borders, to maintain that it be closed to visitors for now and for the near future in any event. I wanted to note that in closing, other jurisdictions do, and we see this in our news, I think, offer up images of different choices that were made with respect to COVID-19. And we've heard in other jurisdictions a second lockdown, lockdown 2.0, is considered or is underway. It's difficult to watch that unfold. It's difficult because we live in one world. It's difficult because this is a world pandemic, and these are places close to us and close to our hearts. Our approach in BC has been uniquely ours. Our response to COVID-19 was early. Our renewal was thoughtful. Our commitment to stopping the spread was 100% all in. Our individual and collective actions have made the difference. Along the way in our BC pandemic, in our fight to stop the spread, we learned that indecision is the acquaintance of COVID-19, inconsistency is its friend, and bad decisions are its closest ally. COVID-19 finds those gaps and pounces. And here or anywhere, that makes people sick. And it can cost lives, the lives of people that we love. All of us, adults, children, everyone, our responsibility is clear. Our duty is defined. Stop the spread of COVID-19. Stop the spread in our community. Stop the spread when we travel within BC. Stop the spread. Dr. Henry reminded us of some of those things that we can do today to play our part in the fighting against COVID-19, what we must do in our BC pandemic. And right now we must remember, we must continue to remember, bend the curve, not the rules. Unfriend the behavior that spreads COVID-19 and follow the rules we know will keep us safe. Aujourd'hui, nous annonçons 13 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 3128 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 pour un total de 189 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 14 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À ce jour, 2730 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please also take your phones off mute. You will not be audible until I call your name. First question is from David Molko, CTV.
Hi, folks. A question for my colleague John Woodward, actually, and this is data-based. His question is, why did PPE supplies in BC's health authorities drop by 2/3 between 2013 and 2019? So why did that happen? And what are we doing big picture long-term to make sure that supply loss or supply shortage never happens again?
Yeah, I'm not entirely sure what you're referring to, but if you're referring to, we have and have had a pandemic stockpile that was developed many years ago, but was enhanced in 2009 when we had the H1N1 pandemic. And it became a provincial managed stockpile in around 2012, 2013. So perhaps that's what you're referring to. There was many things in that stockpile that had been purchased during and after the pandemic in 2009. Some of them were no longer products that were used. and some of them were products that had expired before they could be replaced. So there was a diminution of that pandemic stockpile for sure, and it was something that we were working on. It was an area that I had flagged a number of years ago, and that we were continuing to build up. As you can imagine, it's a challenge to build up insurance policies during a time of peace. But we did have still a manageable stockpile. And again, in 2014, when we had the Ebola outbreak in West Africa and the preparedness that we did here, we increased again some of the supplies in that stockpile. But you're right, many of them had expired or were no longer the things that we needed to use as practices evolved. And, we also went through different changes in the structure of the stockpile. We had Health Shared Services BC, and they went through different administrative changes. But we do, again, early on in this, in January, we brought together all of the different pieces that were provincially managed and did a rapid inventory of what was on hand. So there are stockpiles that are in each health authority within each hospital, and then there's the provincially managed stockpile. So we never got to the point where we had shortages, but we absolutely did need to keep it managed centrally so that there wasn't hoarding in different areas. And we know, we've heard before, that there was a dramatic increase in use of some, particularly respirators and masks early on in this, related primarily to people's concerns about being potentially exposed. And we put in place an ethically based framework to ensure that we could manage what we had. Having said that, we don't want to be in that position again, and this has made it very clear how challenging it is to obtain the equipment that we're used to using and need to use in the healthcare system during a pandemic like this. So that is why all of the effort has been going in the last 7 months to making sure that we are well prepared for the future. Do you want to add to that?
We'd have to see, obviously, the information you're presenting, and because obviously we use significant amount of PPE every year, so the amount we've used hasn't diminished by 2/3 as you'd expect, and therefore the amount we purchase hasn't. But if the question is about stockpile, what I can tell you is that what we've done, we've brought everyone together under the direction of the Provincial Health Services Authority, the Ministry of Health, and we've, I think, those people have done an exceptional job in these circumstances of obtaining a supply provincially of PPE that's really extraordinary. And so hard to comment on facts that aren't presented directly and seem a little bit unclear, but what I can tell you is that this is obviously a significant part of our effort, and we're continuing to build, and will be continuing to build both the stockpile of PPE that we have, and also ensuring and securing regular supply of PPE. And the other issue in Canada, I think, is working with other jurisdictions, working with the federal government, and working with private industry to ensure that the situation that we saw with supply chain is mitigated in future by a Canadian market for many of these supplies. And I think in several areas, in particular in the case of surgical and procedure masks, in the case of eye protection, in the case of gloves, some success has happened already, and I know a lot of work is going into N95 respirators. I think all of that is really important. The final thing, I think, that makes what BC did with respect to PPE different early from other jurisdictions is that we had 6 health authorities in the First Nations Health Authority, all who were involved in those decisions. It's not a large group of people involved under the direction of Steve Brown, who's the Deputy Minister of Health, and Dr. Henry, and working together on both the issues of the utilization of PPE and also issues of supply of PPE. And they were able to bring that together and then incorporate, for example, long-term care homes whose own supply chains had broken down into our supply chain. So all of those were effective actions. Be happy to look at any material you wanted to show us.
Do you have a follow-up, David?
I don't, but I'll circle back to you guys with the data so you can respond more specifically. I appreciate it.
Next question is from Nick Johansson, Castanet.
Hi, Dr. Henry. I'm just looking for some clarity on this this exposure event here in Kelowna. Just about what we know about the timeline so far. My understanding is that 6 people from outside of the IH region brought this COVID-19 exposure into the region, into Kelowna. Was this a single group of people, or were there several unconnected cases? And what is the total number of cases related to this event at this time?
Yeah, so my understanding from the investigation work that is ongoing, that Interior Health has been doing, and that we've been doing in public health around the province and also with other provinces, is that it was a group of people who knew each other who met up in Kelowna, some of whom were from Interior Health, some were from Alberta, I understand, and some were from the Lower Mainland. So it was a single group, and it was introduced in that group. As far as I'm aware, the number of cases is at 17, but not all of them are in people who reside in Interior Health. There's some from Vancouver Coastal, some from Fraser Health as well.
Do you have a follow-up?
The details are still being worked out, and that's the work we do in the contact tracing, is piecing together exactly who had contact with who when, and there are obviously a number of people in Kelowna now who have been exposed through those events.
Do you have a follow-up, Nick?
Yes, I do. I think anyone who's been in the downtown core of Kelowna over the past few weekends can see that a lot of people aren't taking a lot of these physical distancing rules seriously. For restaurant and bar employees who are doing their best to maintain the rules, and I guess when alcohol is involved, a lot of people may not take them as seriously as they would in other situations. What recourse does a restaurant employee have when they're faced with someone who's blatantly flouting these rules?
I know it's a very challenging situation, and I've had some conversations with restaurant employees and owners about this, where people come in with a group of 20 and want to sit at several tables together. And, that is a risk to people who are working in that environment. And there's reasons why we have these smaller numbers right now. And this is what's going to get us through this next year. The last thing we want is to have transmission going on in places like restaurants and bars and nightclubs, or, at resorts and parties, because those are the places that we need to keep those businesses going. We need to give outlets for people to go out there. So I am telling, as we have been from the very beginning, these are, people need to be on their best behavior. They need to follow these rules. It's for your safety as well as for the safety of people who work there. If workers themselves are concerned, WorkSafe BC does inspections of COVID safety plans. Every restaurant, every nightclub, every place that you go needs to have one of these plans. So go to the places that have a reasonable plan. And then we all need to do our bit as well to make sure that we are following the rules when we do go. If you have concerns as well, you can talk to local public health if you're a member of the public with a concern about a facility or a restaurant or a bar or any of the other areas where people are congregating now.
Next question is from Gordon Hoekstra, Vancouver Sun.
Well, this is a question for Dr. Henry. Thank you for taking my question. I noticed that not this today, but the previous 5 days, there was cases of either 20 or above 20. And if you look back at the numbers going back to May, I don't believe that there was a handful of times when it reached 20, but not in in 5 days in a row. Should the public be concerned in this uptick in cases?
I know it was distressing to me to see 20, especially 25 one day. That's way above my comfort zone. But it is not, as we've talked about, it's not unexpected. And we do know where those cases are. That is the other piece that we're trying to balance here, is us increasing our travel, increasing our contacts in a measured way, but us in public health being able to respond when we have clusters, where we have cases, making sure we can find those links and find people who are exposed so that they can stay away from others and we can stop those transmission chains. So that's the work that we're doing, and that's why we are, the reason we have that number of people is because we're finding people who are connected. And to me, it's a positive thing as well. It means we're doing that work. We're testing the people who need to be tested. People are paying attention to it. But it is cautionary to us that as we start to go out more, and as you recall, this is sort of as we're getting into the second week of the first incubation period since we moved to phase 3, that's when we knew we were going to start to see people cases increase. I will also say that many of those, a good portion of those cases are related to the ongoing outbreak in a long-term care home at Holy Family, unfortunately, both in staff and residents. And so that is something that we are also very much actively managing.
Do you have a follow-up, Gordon?
Yeah, is there any way to know, like in terms of when we see the numbers bounce up and down, like how they're related to the, that kind of 65% of normal interactions? Is there a level when we see cases hit a certain point that we would know that we are going beyond that kind of, interaction that is sort of being modeled that would give you some kind of comfort that we're not going to get, a big upswing?
Well, the modeling is not that precise in that you can't do it on a day-by-day basis, but we do follow it weekly. And so I was looking at the update of the model yesterday, and we still are skirting that line. We're right around the 65%. The RRT, the reproductive number, has been hovering around 1. What we talked about last time, when we have small numbers, and thankfully 20 is still small numbers given our population, and we need to remember that many of these are linked. So if we're seeing if it was 25 cases that were popping up in the community that weren't linked to either the Holy Family outbreak or other outbreaks, that would be more worrisome. But many of these are linked, and that's the work of public health to help us understand that and where we can find people and where we can trace them. So we are hovering around 1, which is sort of pushing the limits of where we want to be. So this is going to be our dance over the next few months, where we do what we can do, we travel, we have those social interactions, but we do it in a measured and thoughtful way so that we can find people quickly. So making sure we know the people that we're with, or that if we're in a restaurant or a nightclub, that we're able to contact people. And that helps us make sure that people know if they're at risk, so they can prevent transmitting it to the people they're closest to. But that is absolutely going to be our dance, if you will, for the next few months.
Tanya Fletcher, CBC.
Hi, Dr. Henry. With some of the recent community exposures linked to groups of people gathering indoors for, say, parties or celebrations like we saw in Kelowna, is it time to reconsider allowing indoor gatherings with a maximum still of 50 people? And if we could get an answer in French as well, please. Thanks.
Yeah, there's lots of concerns about that, and I look at what's happening in particularly in the United States, but even in Montreal, where they've had bars and nightclubs where there's been huge numbers of people. And what we are working at is, we've been consistent with 50. 50 is a reasonable number. As I've said many times, there's no magic or science behind it. It's a number that we think we can follow people, we can find people, we can do the contact tracing, and it's also a number where you can maintain physical distancing as much as possible in many situations. So we have no plans on changing that. What we are looking at are what are the things that we need to do to make those closed spaces where 50 is actually quite a big number safer. So things like making sure you have an idea of who's in that group, and if you're having a party like in resort in Kelowna, and we are spontaneous, particularly young people, and they invite people that they may not know, but making sure you have some way of contacting them. And this is one of those places where one of our notification apps may be helpful, and we're looking at how we can put that into supplementing our contact tracing processes. So those are the types of things that we're looking at. I don't believe it's good to shut things down because it just drives things underground. It's much better for us to work with industry, to work with residents, to work with people and say, how can we do this in the best possible way, in the safest possible way right now?
and I think what Dr. Henry's saying is a little bit what I was saying yesterday, is that if we're having a party at my place, then I think the maximum number of people, given the size of my place, would be about 4 that would invite, and that we also have to, the maximum of 50 is for gatherings, but in private parties, in dinner parties, in house parties, in apartment parties, we have to show common sense and understand, and I think that's a critical thing, whether it's in a hotel resort or whether it's in our homes. Je veux dire en français qu'il y a une limite, actuellement, la limite est 50. Ça va continuer à être la limite. On ne veut pas éliminer la possibilité de se mettre ensemble, se rendre ensemble, d'être ensemble avec des mondes, parce qu'on veut une réponse publique. Ce qu'on peut dire de la situation à Kelowna, c'est que oui, il y avait un problème. Oui, il y avait transmission, mais il y avait aussi la coopération des gens qui se sont rendus malades, qui ont coopéré, qui ont aidé la santé publique à répondre, à trouver d'autres gens, à mettre des avertissements. Et on veut continuer d'avoir une attitude d'ouverture à l'égard de la santé publique. Et cette ouverture est essentielle pour nos efforts de se battre contre le COVID-19.
Do you have a follow-up, Tanya?
Please, thanks. Dr. Henry, going back to contact tracing, have you been able to, I guess, first of all, trace the source of the confirmed cases on the Oliver Cherry farm? And how big of a concern is that overall, especially looking at Alberta? They announced today, 780 new cases, 57% were under the age of 40, and 30% of those have not been linked to any known source. So how close are we to seeing transmission potentially get out of control here?
Yeah, so we're not that close. They have not yet determined exactly who was the initial case in that cluster. There's an ongoing investigation of all of the group of temporary foreign workers, some of whom tested positive, as well as the farm family from that farm. So that investigation is ongoing. I will say that of the people who've been tested so far, the vast majority of them have been tested negative, and there's nobody with obvious symptoms. So it is a very different situation than some of the the one other farm outbreak that we had when it was detected. When people realized it, there was quite a lot of people who were ill. So it worries me less in that respect. And the other part of it is we know what to do now to manage these types of outbreaks more effectively, and Interior Health is on it, I know, and we're working across the province and with other with people who've been to other provinces to see if we can find those links. So we have very few people that are not linked to a known cluster or case yet, not 30% at all, very few. And the other piece was around young people. We are seeing some young people, as we've seen, become sick with COVID-19, some of them mostly with very mild symptoms. But we haven't seen that sort of bulge that we're seeing in the United States and in other parts of Canada in the 20s and 30-year age group. And I think part of that is because people are doing the right thing here for the most part, and that we've still had very small numbers and small clusters so far. But we need to keep that up, and we all need to do our bit.
Next question is from Keith Baldry, Global News.
Dr. Henry, Minister Dix, thanks for taking my question. In regarding the border, Dr. Fauci in the United States, when he was still allowed to talk, said that they were going to be hitting 100,000 cases a day, and he's been proven right in terms of the trajectory. Is it your expectation and desire that that border remain closed well past August 21st, considering what's going on down there?
Yeah, it's a very challenging thing to know, and they've had record numbers, and unfortunately what we're starting to see are what we call the lag indicators, the hospitalizations and the deaths now starting to increase, even though many of the cases are in younger people. So that's very concerning. And yes, I don't believe that there's any reason that we would expect to be able to safely have visitors, people who are here as tourists in the coming weeks or months. I'm happy it's going till August, and we'll need to, of course, make sure that we watch carefully and monitor what's going on. There are a lot of people who have connections across our borders, so we are looking at how do we make sure if people need to come into Canada, it can be done safely. And we need to look at people like students and foreign students who contribute to our research programs in our universities and other things. And how can that, other people who are coming across our borders both ways, and how can that be done safely? And to me, right now, that means there's a 14-day quarantine period, no exceptions, because that's how we keep our communities and we keep people safe. Because if they are in our care, or at least being monitored during their quarantine period, we can get them the care they need should they become ill. So there's a dual purpose for that. So we do need to look at special populations, I think, over the coming months, but I don't see anything changing in terms of tourists and visitors coming, especially short-term visitors.
I'd just say that August 21st, and we're very appreciative of the work of the federal government in extending the ban on visitors both ways with the American government, and obviously it's important both ways too. This is not just a restriction on American tourists or American visitors coming here, but a restriction on Canadians visiting the United States. That's part of the agreement, and I think that's an important part of the agreement. If you remember the previous presentations that Dr. Henry has made around modeling and around the trajectory of COVID-19 in British Columbia. And also note that, of course, the situation is very serious in the United States. There are outstanding people involved in attempting to control COVID-19 in the United States, and a huge commitment by really hundreds of millions of people. And so we're thinking of them, and we are on their side. We want them to succeed. And I'd also note that there are other countries in the world, because this pandemic has not got better, didn't get better in June around the world. There are other countries in the world with travel to British Columbia and travel to Canada that are facing significant challenges, which have record day of new cases after record day of new cases. And so we have to continue to be vigilant. And finally, we in no way, in absolutely no way, can be smug about this question. This is a worldwide pandemic, and as long as it's a worldwide pandemic, we are at risk in British Columbia, and we have to continue to follow the advice, the guidance, and in some cases the rules that have been presented by public health, by Dr. Henry, by medical health officers around BC. It's critically important to do that so that we not just have our situation here that may be better than other places, but that we maintain it over time in the weeks and months to come.
Do you have a follow-up, Keith?
Yes, just in regards to, again, to the border, anecdotally, we keep getting anecdotes from people saying, I've seen all these American license plates. Based on your knowledge of the statistics, do you think that is actually correct, that we're getting people across the border improperly, or is the system working as it should?
I think it's a bit of both. There are certainly people who are coming across the border, and we have to remember Canadians can come in, even Canadians who are living in the United States right now. There's no restriction on Canadians coming home, but they need to self-isolate for that 14-day period. And we have been working here in BC to make sure everybody has an appropriate plan, and CBSA has taken that on and is monitoring people. So we can't assume we know the story of the person who's driving a car with a license plate from the United States. They may have been here for a long time. They may have been here and done their incubation period in isolation and are now safe to be out with us as well. So I think we need to be charitable, and we need to understand that everybody has a story, and there are reasons that people need to come back home to care for people, to care for family, and for many other reasons. And I mean, quite frankly, with what's going on in the U.S., if you had the ability to come home to Canada, I know many people have been taking that opportunity.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I'm sort of on the same line as what Keith was asking about. Hopefully you can hear me today. First off, just considering all the exposure warnings that we've been getting linked to flights arriving from the U.S., what does that tell you about travelers still getting on planes when they're sick?
Yeah, and it is not just flights from the U.S., I will note. There's flights from other countries, but there's also internal flights. And we've had people who were actually sick on a flight coming in from Toronto, from other parts of Canada. So yes, these are things that cause me great consternation. The airlines, all the airlines need to have processes in place to screen out people, but we need to be honest about it. And part of that means if we are not feeling well, we need to have the ability to postpone or change our flights. Those are important things. The other important thing that we need to have is people making sure that they are cleaning their hands, wearing masks, all of those important things, but they stay home if they're ill. And from the airline perspective, making sure we have flexible policies and making sure we have appropriate contact information. One of the most challenging things we do is trying to get flight manifests a couple of days later when we recognize somebody who might be ill. And the type of information that's on those flight manifests is often not very helpful in trying to follow up people, which is one of the reasons why we also post things publicly. So to be able to more efficiently identify people that are within rows of somebody who develops symptoms after a flight, or even if they had symptoms on a flight, those are things that would be really helpful for us.
Do you have a follow-up, Marcella?
Just regarding Minister Dix, last week you told us how many care homes have safety plans approved to allow visitors, and it was 61. Do you know how many in total are applying for this, or how many more have been approved this week?
What I'll do is provide a detailed briefing on that on Thursday. What I can tell you is that visits are proceeding in lots of care homes across BC, that the process is not a perfect process, but I think that care homes are doing a very good job in general, and I think you'll see many, many more than 61 when we report out on Thursday. As you'll be aware from talking to people, that many of the visits are relatively short at this time as everyone gets used to the visiting process, and that it can be for people who have been apart for some time, particularly people living in care and their families, a very emotional experience. So I want to thank all the people in long-term care who are working to make this a reality, all the effort that's gone into it, all the resources that are going into it, but also the importance of these human interactions. So we'll have a detailed report on this every single Thursday, Marcella, over the next number of Thursdays, but I can tell you that it's significantly more than in the initial days when plans were being submitted then approved, and you're going to see a significant jump in that number this Thursday.
We have time for one more question. For any reporters that didn't get to ask a question today, there will be a statement released this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Sean Brady, Kamloops This Week.
Hi, Dr. Henry. When the pandemic was first declared 4 months ago, and you and your staff were making preparations, where did you guys think BC would be at in mid-July compared to our situation now? And what do you think our situation will be at the end of the summer? Thank you.
That's a really good question. Needless to say, I've been thinking a lot about this, but when we put in place some of the restrictions measures in March, we were facing the upside of the epidemic curve. And when you're there, you never know how high it's going to go and how long it's going to take. I had some hopes then, and they have been dashed, that we might be able to actually control it globally and stop the outbreak like we did with SARS-1. But that is no longer a reality. So what we have been able to do, I had no idea what July was going to be like. It was either going to be really, really bad still, or we did what we needed to do, and we are where we are. So we were able to flatten the curve, but what that has mean is that we've been grumbling along, and 10, 15, 20 in the last little while. And as we start doing more and having more contacts, that's our reality now. So that is going to be our reality, in my opinion, for the next months until we have an effective treatment or a vaccine. So this is going to be our, I talked about it, our philosophical phase that we're going through, where we have to adjust to these are the things that we're going to be able to do, but we have to continue with these limits, or else we're going to see this virus take off again. So we have learned a tremendous amount about how this virus spreads, what are the risk environments, and that's allowed us to open up things as much as we have. But we still need to pay attention to those risk environments. We need to minimize the opportunities for the virus to transmit to large numbers of people. We need to manage them with public health and the expertise of my colleagues in public health across the country and across BC. That is what is going to keep a lid on this, so that, and I fully expect that this is the dance that we'll be in for the coming months.
Do you have a follow-up, Sean?
No, that's good. Thank you.
Thank you. That's all the time we have. Thank you, everyone.